The idea of this panel discussion is that the year is 2024, and there are many interesting careers in science outside of academia. And so we wanted to have some people who have been working in various contexts outside of academia in specifically bioinformatics related roles, just to kind of give you an examples of what these careers can look like and how they compare and also how to get there. And so I'm very delighted to call to the stage my four guests. First, Anabella Trigila, who's a senior bioinformatician at ZS. And please come on up. Next, I'm going to call up José Fernández Navarro, Director of Predictive Analytics and AI at AstraZeneca. Next up, Chipo Mashayamombe-Wolfgarten, Principal Clinical Bioinformatician at Birmingham Women's and Children's NHS Foundation Trust. Thank you. And finally, last but not least, Raúl Alcántara, Aragón, Senior Bioinformatics Engineer at Quotient Therapeutics. Thank you. And I will join shortly. Thank you. So thank you first for agreeing to speak on this panel. It's really great to see you. I hope you've had a great summit. I'm going to ask you a number of questions. First, the format. Our guests are going to introduce themselves, tell us a little bit about their education, their career trajectory, and what their role is today. And then after that, we'll have a second round of asking specific questions about those careers. And so to start, I'd like to ask, let's start with José. Can you tell us a little bit about yourself and what you do and how you got here?
Hi, my name is José. I have a background in computer science, and I started as a software engineer in the industry. But then in 2010, more or less, I decided to switch. I have a strong interest in computational biology, so I moved to Sweden, to Stockholm. And I spent there 10 years. I spent a lot of time with Phil and Maxime. And I did my PhD, and I did a bunch of things. And then I moved to Barcelona 5 years ago to be group leader of bioinformatics unit in a hospital. And after that, I grew tired of academia. I think most of you can relate. And then I became a consultant for a bioinformatics company. Then I joined a startup, Pixelgen. I don't know if Alvaro's here. And then after that, I joined AstraZeneca. So yeah, a little bit of everything. I think diverse background, academia, industry, small, big companies.
And can you tell us a tiny bit about what your role is today, what it consists of?
Yeah, the name sounds fancier than, you know, I have to put AI in everything. But I director in a group that is giving support to different divisions in the safety space. So we work with different problems, obviously pipelines and dashboarding, software, building models. And so we provide support to a specific division inside the company.
All right. Thank you very much. Next, I'd like to ask Anabella to introduce yourself.
Thank you very much, Geraldine. So I'm Anabella. I'm from Argentina. My background, my undergraduate degree was in biology. I was doing population genetics as well, and during my initial years. Then I did a PhD in comparative genomics and evolution, where it was a hybrid, so I got to do things in the bench and then analyze my results. I fell in love with bioinformatics during that time because I was able to advance a lot during my own analysis. And then after I finished my PhD, I wanted to keep on working in that area. So I joined a few startups that worked in clinical genomics, and it was very interesting to see how the knowledge I had in bioinformatics could be applied to something that had a real impact. When I was doing that, I also found out that many processes could be improved. That's why I wanted to implement something and Nextflow came up as the best solution. And I didn't know Nextflow. I was a user during my studies, but I wasn't a developer. And that's where I joined the mentorship program, which I'm really glad that is coming again, because it was like a transformative experience for me. The most valuable asset was to get to know the NF Core community. I was mentored by Matthias, who is not here, but I say hi if he's looking. And he is a member of the NF Core community, and he introduced me to things like from building modules to building a whole pipeline. So I acquired those skills. I was able to apply that to the startup I was working in. And then after that, I joined the current company where I'm working at as a Nextflow developer, which is Seqera, a consulting company.
Thank you very much. Next, Chipo, can I have you introduce yourself?
So mine is a bit convoluted, like my journey to getting here. So I'm Zimbabwean originally, did my undergraduate there, actually worked in the insurance industry. The plan being at that point to become an actuary. When I moved to the UK, I sort of changed the plan, as you would. So gathered a few degrees along the way of obtaining a PhD in systems biology, and did that with Adam, who's at Seqera. He's somewhere there. Oh, there. And during that time is when I realized that I did not want to be in academia. I found it too high pressure, you know, the need to produce papers at a certain rate, and I'm not good at writing, so I figured that wasn't for me. And fortuitously, I heard about the NHS scientific training program, which meant I could work in the NHS, make an impact, and also still do bioinformatics without, you know, the need to produce papers. So that's how I ended up joining the NHS as a trainee clinical bioinformatician at the time. I'm still in the lab that I did my training in, and I've gone through the ranks, and I'm now the lead bioinformatician. So my current role spans from training upcoming clinical bioinformaticians, as well as making mundane decisions like, you know, infrastructure stuff and all that. So yeah, that's me.
Thank you very much. And now Raúl, if you could.
Hello, I'm Raúl. I started out as a physicist and later transitioned to molecular biophysics, where I started working with structural computational models. At that point, I was living here in Barcelona, and I had always liked working with sequencers. So I tried getting a technical position at the CINAG, which is a sequencing center here in Barcelona. And I managed to get a position there for bioinformatics production. Basically, I was in charge of the multiplexing and the very first steps of the sequencing process. Later, I found it difficult to stay here in Barcelona, so I started looking for another position, and I found a technical position at the Sanger Institute. So I joined the Cancer, Aging, and Somatic Mutations over there, and started working with scientists on some of their methods for doing somatic mutations. And while I was there, I had the opportunity to join this startup, which was, well, is a spin-out from the Sanger Institute, which was also very interested in trying to leverage somatic mutations in their attempt to use them as to identify possible drug targets. So I was able to join Quotient Therapeutics 2 years ago. And in that startup, my position is senior bioinformatics engineer. And I'm basically in charge of doing the heavy processing of the pipeline the deployment. So I work very closely with with Nextflow and Seqera platform.
All right, thank you very much. So now that we know our guests a little bit better, I'm going to ask each of you one question, but after you are done, your fellow panelists are going to get to comment. We'll have a little bit of discussion. I would love to see some agreements, some disagreements if possible. That's always more interesting.
Do you want drama?
Yes, drama, please.
I didn't bring my boxing gloves, sorry.
So let's start. Anabella, I'd like to ask you, what do you like the most about your current job, and how does it compare to your experiences in academia?
Probably the diversity of projects that I get to work on. So in academia, you get to be very specialist on a single topic, and that's really cool because you get to know your subject. But here, you get a whole diversity of projects, and that's fantastic. So I would say that perhaps you agree as well. One of the main reasons why I became a scientist was curiosity and problem solving, and I get to do that. You don't have to do a research career in academia to get that. There are other opportunities as well.
Well, with certain limitations, I guess. Depends. In a big company, you always have to focus on impact to the portfolio. You know, you're a small piece in the big system, so you have certain freedom, but not the same kind of freedom that you get in academia.
Have you had the experience of a project you really loved that had to be cut because it didn't make money?
Yes. And you know, it's always, you have to get exposure, impact in the portfolio. So, I mean, but you can find your way around, you know, and I like to fight the system. And you know, so, you know, it's just a matter of trying to, I like what Ivan said, you know, like to talk when you have to convince people that they are not technical, you know, how to make this transformation to use proper standard, you know, software engineering. You know, like an Excel table is not a database. Like a Word document is not a pipeline, but sometimes you'll be surprised how many people think that that's the right way to go, you know, breaking silos. So, yeah. So in a big company, you have to navigate that landscape, but there are, you know, successes sometimes, you know.
Indeed. Raúl or Chipo, do you have any, would you like to add something?
Yeah, I think I have more restrictions than the two of you when it comes to working, working in the NHS, and despite like the restrictions that I have to like work with, I find contributing directly to patient outcomes is something I really like. I mean, whilst our colleagues in academia conduct, you know, research which is eventually translated into clinical practice, I find I'm at that, call it bleeding edge, where I'm actually applying what they've developed, and I find that quite rewarding. And that's one thing I really like about what I do.
And that connects a little bit to what Edwin was saying about, in that presentation about the work of Genomics England with the newborns, right? Having these stories of these young babies, young children, having a fighting chance is really heartwarming.
Oh yeah, it is. We don't always work nicely with Genomics England.
Ooh, there's the
no,
drama.
I'm kidding. I kid. No, so we do work. I think he did mention in his presentation that they've worked like with the 100,000 Genomes project, that they work in conjunction with the NHS. So most patients come through the NHS and you know, through the recruitment and all that. So, and some of this, you know, the sample collection is also done through NHS laboratories, and so we work together with Genomics England. It's really rewarding, you know, hearing those stories. Yeah,
I can imagine.
Really, yeah.
Raúl, would you like to chime in?
Well, yeah, for me, it might be a little bit of a different experience coming from a startup. For me, it was very interesting. Well, originally being at Sanger, which is a very big chip, so it was very difficult to change directions quickly. So it was very rewarding here at Quotient that I could try new technical things, and everybody was really excited about trying new things all the time. Yeah,
that's fantastic.
I really like that.
Yeah. Any additional comments on on the differences, the constraints, the advantages? José, say something positive.
I like academia, you know, I have a good time. And, but it's very different, a big company, a big pharma, the advantages you get exposed to the whole, you know, everything, you know, the whole process of the whole pipeline of drug development from discovery, target identification, safety, validation. So you get to work with all the omics that exist, huge data sets. You know. But in academia, you have a little bit more freedom, I guess, in the way that you can explore things and you can choose your own pace, and you know, it's different, you know. But I'm happy where I am now, anyways.
I'm very glad to hear it. Let's move on then to Chipo. What's the biggest challenge you faced in your career development so far, and how are you dealing or have you dealt with it?
That's a really good one. So currently, the challenge that I'm facing is I say recently, it's 2 years ago that I've moved into a managerial role, and I'm struggling to let go of being more hands-on and being a technical person. And for those who figured it out, please seek me out, let me know how to deal with it, because I actually haven't figured out how to. I am trying, you know, the whole delegating, but certain things that I developed like hundreds of years ago, and if someone comes and says, oh, you know, there's a new way of doing this, we can develop this further, but because it's my baby, I feel difficult. I feel it's really difficult for me to hand that over to someone else to work on, but because of other responsibilities that I now have, I kind of have to do that. So it's that ability of recognizing that my role has changed and coming to terms with that is the thing that I'm struggling with at the moment.
I sympathize. I went through something similar with a little project that starts with G and rhymes with ATK. So, do any of our other panelists want to chime in?
Well, I agree with delegation is very important, you know, when you start managing people, you know, you have to enable them, you know, instead, you know, and you have to understand that people might choose different solutions and they might do things differently with different speeds, and you have to just try to enable them, give the right tools and support them. And it's difficult, for, I guess, for some people.
Oh yeah, I think I need someone to just hold me down to help me let go, but yeah, thanks.
You know, CrossFit is sports and martial arts.
It's an option.
I think this is a very interesting topic, the career progression, because I also struggled with that myself, because I would also like to do a little bit of managing. But then do you want to go the full 9 years manage, or do you want to stay like a principal, just lead like a very small team or something? That is something that I also struggling myself.
And I feel like that's an important point to make, is that developing your career doesn't necessarily mean becoming a manager and becoming a boss and or leader or whatever. But there are also some careers where you continue being a principal, like individual contributor, but highly specialized, well compensated, in a way that is perhaps less common in academia.
But that's new for some companies, I have to say. In the tech industry, I think it's quite common. You have the 2 tracks, but in the pharma world, you know, it's not as, you know, it's starting now, I think, but it's not as common.
It needs a bit of a culture change, maybe.
Yeah.
Chipo?
Yeah, I find in the NHS, so we have like a banding system. So if you're a certain band, you're expected to have certain responsibilities. So regardless of whether you're a clinical scientist, a nurse, or even like a doctor, if you're a certain band, if it's decided that's a managerial band, then you're going to be a manager. So often people have said, you know, we didn't become clinical scientists to manage people, but because we've progressed, we found ourselves in these positions where we're having to deal with humans. I mean, as someone said, we're basement people and don't deal with humans very well. But I find myself in that situation where I have to manage other humans and deal with other humans outside of bioinformatics, which is really frustrating at times, but I'm going to use the word challenging, I think. Yes.
I think some people say as an only option to get career progression, and not everyone is, you know, is a good manager, you know. So you have to give people the option to have individual contributor track, you know. That's very important, and to focus on, you know, you have to have a good empathy, and you know, people's skills and know everyone. Sorry to say that. Sorry to break it to you. I think we all have experienced like a bad boss, at some point.
Have you found that the training, because in academia you don't get trained to be a PI, like you become a PI and then you're just expected to do all of that. But have you found that training is more available on the industry side? Or not? Oh, any of you.
I mean, there's training, yeah. I mean, you can take a course, but does it work to take a course to be a good person? I don't know. It's just no. I mean, there are certain things you can definitely do. Training and
I feel like there's to your point. There's empathy and there's the human traits of like being a good person or caring about the people who report to you. But then there's tools, right? There's tools and methods and ways to organize things, ways to evaluate performance, ways to that I think can be taught.
Yeah, for sure. I mean, I'm just joking.
Yeah, sure. Anabella, did you want to?
It's related to this perhaps more collective nature that industry has compared to academia. Normally, or at least my experience in academia it was just me alone working on a project, perhaps with your PI, but that's all you have. And one thing that newcomers to industry find challenging is working in groups or with other people. So there you have to do, like, you're not the sole owner of your repository, so you have to interact with other people, do reviews, PRs, etc. And in that way, I do recommend people that if they do not have the experience of interacting with others in like this more production setting, the NF-Core repository is a great way to start, and you can learn a lot of skills of working with others there.
Yeah, I fully agree. I mean, and I think Ewan mentioned that yesterday too, like going from a very individualistic approach to, I have a project, this is my project, and to work on an industry setting, in a group, following standards and, realizing that maybe you have to collaborate because you cannot do everything. So yeah.
You're saying I shouldn't commit directly to master? Oops. All right. I'd love to keep going. Let's move on to the next question. Raúl, I'd like to ask you, what do you think is the most promising or exciting direction to pursue in bioinformatics in the current landscape?
Well, from the scientific point of view, in my opinion, is like the incorporation of images and with genomic data. We're trying to do that, which can be difficult using AI. From the technical aspect, I think is this being able to utilize all these compute resources that are available now, that I think are two interesting areas.
So very important to stay on top of the technology development, not just the code itself, but also all the infrastructure, the methodologies. Fair. Any opinions from the panel on this point?
On the compute bit, just a comment really. We're a bit behind, I'm going to say, in our lab, so I don't speak for the whole NHS. And whilst most people in this room have probably been like working in the cloud for ages, we're really excited to move to the cloud.
Yeah.
Well, if I had to add something, scientifically, I would say, multi-omics, imaging, AI, applying AI the right way, not chat boxes. And, multi-agents, things like that are very, very, very trendy now. But I would say, like, startups, I think you want to start a career in the industry, I would say that's a really nice option because you get exposed to a lot of different things, fast-paced problem solving. It's a good learning experience, and I have a good experience with startups, and I think it's a good choice to start.
Very good. Anabella?
Same thing. I do see a lot of interest in spatial transcriptomics, for example, and probably
co-develop it.
So yeah, that's what we see as well, and probably many of the topics that you've seen here or in the hackathon and that got many questions. Yeah, those are the places that you'll need to learn about.
And what would you say is the best way to learn if I'm interested? What do I do? Do I Google it?
That's one way. But I do tend to have this aspect of just approaching people and asking, like, if you're an expert on something, I ask you, how did you get there? So when did our path differ that you were able to get that knowledge that I don't have? So just talk to people, I would say.
And yes, join the community, embrace open source, see what other people do. Be aware of what your limitations, learning is a long process, and I feel like now younger people, they want to do things very quick. And, it's a process, like in karate, in martial arts, you start at white belt and, you have to go. So be aware of your limitations and just get deep into stuff and take courses, join communities. And F-Core is great. I've been always a big supporter. So see what other people do, open sourcing, collaborating is the best way to learn, by practice.
Join hackathons as well.
Yeah, for sure.
Hackathons are a great place to, because you're there, and I was talking to somebody about the hackathon from earlier this week, and they said, I really, really enjoyed it because I can just go over to the table and talk to the person and they can't run away, basically.
So just a question on hackathons. Are we expecting experts to turn up for these or people who are still learning? Because I think, like at the past summit, we had people who didn't attend the hackathon because they didn't think they were skilled enough to be a part of that.
Yeah, we hear that all the time. And basically, we definitely want experts, but we also want people who are early on in their journey. I think to be fair, it is difficult if you've never seen a line of Nextflow code. Showing up to the NF Core hackathon is difficult, and you might not get as much as if you do some training beforehand, so you understand what are the pieces. So you want to have the base components in place, so that then you can, as part of the hackathon, you can learn, well, how do I use these in practice? And then you get to the more learn by doing side of the journey. We definitely want people who are early on, but again, to have a productive and enjoyable experience, it is helpful to have done a little bit of training. And that is part of what we're integrating into our new trainings, is getting people to the point where once they've completed that, they would be in a position to have a good hackathon experience, for sure. Thank you. Raúl, any comments on, any additional comments on this part? No? Okay, that's great. That's great. All right. So then I'd like to ask, and we've already sort of started, but Anabella, what advice would you give to someone? And you've already given some, but if you had to summarize your advice to somebody who would like to pursue a career like you?
Talk to people, probably, but also be confident on yourself. If you've been in academia, you have a lot of skills that are required in industry. You were able to get from a topic that you probably didn't know much about to become an expert, and you probably learned that on your own. So you have the skills, the learning skills, which is probably the most important part. So have the confidence, and then approach people and ask about positions. Learn about what people do in their daily jobs. See if you like that. Yeah, that would be my main advice.
Yeah, I touched a little bit on that, but I would say patience and embrace error. Don't be afraid to admit, oh, I don't know about this. Be aware of what you know, the level of skills, and work on, towards what you want to improve. Yeah, curiosity, because, now we live in the world that you can find, solutions for things, pipelines, but it's good to understand, get deep into the stuff. I think that's a good quality to understand. If you're using algorithms or you're using methods, good to try to understand, that will make you grow more, and faster. Otherwise, you don't grow. You just stay like.
So I'm going to be a bit different, given where I work. So if people want to go into like clinical bioinformatics, and specifically at institutions like NHS, where there are standards and restrictions that need to be followed, you just need to be open to having restrictions placed on what you can do, and just being aware that everything is standardized, needs validating, verifying multiple times before it can come into use. And therefore, you won't have that ability to use the latest shiny thing, which I've noticed with the younger generation. They're really finding it very frustrating because there's so many new things out there, a lot of exciting technology, but we can't use that until we've validated, verified, and checked and triple checked it. And by the time we've done that, the next best thing has come along. And in my line of work, always remembering the patient comes first, and therefore everything you do needs to benefit the patient. If it doesn't, then it's not worth doing. So might not be worth doing, even though it's exciting. Yeah.
Okay.
They're not recommending to follow you.
So, in my experience, I would recommend that young graduate would try to get some experience on the cloud. That I found it, in my experience, very frustrating because it's something that you had to pay. So I wasn't able to do it easily. I was very happy to hear that Francesco's talk that they have this very nice setup on their course that they do that. So just basically being able to put on your resume that I run workflows on the cloud, even if you're not an expert, but that I think opens doors. Yeah.
Yeah, that's a very good point. We, as part of community outreach, one of the things we do, and Marcel does all this work, is look regularly, like every week or 2 weeks, looking at all the job ads in bioinformatics and kind of looking at the skills, et cetera, that are required. Now, we look specifically for job ads that require or ask for Nextflow experience, and then we tweet that out with a list of the latest jobs that ask for Nextflow experience. And we are increasingly seeing it becoming a basic thing that you have to have as a bioinformatician is experience in one of the major workflow language. Nextflow is often mentioned as the example, which is very gratifying, as you can imagine. But I think it's indicative of the fact that these things, and cloud is often mentioned as well, these things are becoming the must-haves, like that's what gets you in the door. And you do have to take job recs, the things that are asked for in job descriptions with a grain of salt, because it's often a wish list, depending on who is exactly putting that list together. It can be a bit of a wish list, and there's never anyone who has all of it, like, to be clear. I've done a lot of hiring, and there's always things that you have, that you're stronger on, that you're weaker on. And the thing is not to look at, do I meet the whole checklist, but do I have the most important things here, and can I make a case that the rest I can learn? Because to your point, by the time you've gone through academic research and maybe you have a master's or PhD or something, you've proven that you can learn things. And people understand that, hiring managers understand that. The trick is getting past the recruiters. But if you get past them, then you can make a case, that you have all these skills, and for the rest, you're capable of learning. But it's true, like workflow management, a real workflow language plus a bit of cloud experience, even if it's a little bit, it doesn't have to be, you don't have to have been in charge of 10,000 whole genome processing. But a little bit of that, I think, goes a long way for sure.
I couldn't agree more. Like personally, I focus on when I'm hiring, like core skills, problem solving, things that you can prove, because it's, our field is not regulated, so everyone can be an expert in everything. You can just say that in your CV, ChatGPT, but like to prove to the core skills, problem solving, engineering, programming, and I think that's good things to focus if you hiring. And
To that point, we've heard a lot about AI in all sorts of ways. Do you feel like that's something that's becoming, or at least machine learning, AI, deep learning? These are all parts of a spectrum, right? Or something more nebulous than that, probably. Do you feel like those skills are becoming necessary for bioinformaticians, or they're things that you should be literate about, but you don't have to understand how the deep guts of these methods? Anyone?
Because I'm in the middle. I don't. Depends on the position. I think it's very trendy now nowadays, and a lot of companies are investing a lot of money. But it depends on the position. If you're not going to apply AI, I mean, what's and so most of I would say in bioinformatics probably AI is just a small like portion of the whole set of skills that are very important.
Would it be fair that it's kind of maybe if we were to resurrect the age-old debate of what's the difference between a computational biologist and a bioinformatician, not to say anything controversial, that maybe if we imagine as a bimodal distribution, with bioinformaticians being more assembling things together and executing versus the comp bios developing the algorithms. Anabella, I see you nodding. Do you want to?
Yeah, we've talked about this.
Otherwise, Jose is just going to keep talking. No offense. No, Anabella.
Okay, and yeah, I still feel like a biologist who learned how to code, and I admire those people who come from the computer science background because, yeah, I don't know how they do it, but yeah, I do admire you. But it's great that we get to work together on many things, and also with some other people like software engineers or data architects, because we need to find the common language to talk on, and then you learn a lot about the other fields. But yeah, I would say that I'm a bioinformatician.
Yeah, I would say I'm a computational biologist, I guess. But I think it's good to diversify the terms, because in data science and machine learning, you have machine learning engineers, you have people building models, people are, different specialities. So I think bioinformatics field should maybe head in that direction to have different tracks and different.
I actually don't know, but I want to say I'm a biostatistician because my background is in statistics. But
That's a cool one.
Yeah, I don't know. I think I'm more of a bioinformatician than a computational biologist. Yeah.
I would consider bioinformatician. Yeah.
Very clear answer. All right. I've got a couple of questions from the audience in Slack. Feel free to add a few. We've got about 4 minutes left, so we'll do a couple minutes on audience questions, and then we'll wrap up with some final thoughts. How family-friendly is it, so industry in general, compared to working in academia? Any experiences that you'd like to share? Raúl?
I found it more engaging, actually, the social interactions, because, again, it's a startup, so it might be a little bit out of the ordinary, but you get the feeling that so it is like a small group, a small ship, and you're all together on that, and so that you feel that if the startup is going to be successful, you all have to kind of get together, be able to collaborate, no?
Well, that feels like it's pitching the startup itself as the family. I think the question here is a little bit more like, if you have a family outside of work, how does that work?
I can comment on that. I'm fortunate enough to work for the NHS, which means we have varying types of work patterns that one can adopt. I actually don't work Fridays, for instance, and I've been able to compress my hours because I find that works well for me. And I have colleagues with children who only work certain hours of the day because they need to take their children to school, and stuff like that. So I think it's very dependent on your employer. But I am really grateful that I have an employer who allows, people to conform their pattern to their to their home life. Yeah.
Yeah, I would say if family is important, move to Sweden, Scandinavia. They're really family. They have a lot of benefits. But I would say AstraZeneca, it's quite. They put quite a focus on work-life balance, employees' well-being. So it's a company that really tries to make employees feel happy and with family, and they have a lot of benefits. So in my case, it's good.
Yeah, same experience. You even have courses on when to take pauses and how do you know if you're about to burn out. But yeah, it's something that is considered, so you're not expecting to burn out, and you can reach some other people on your team as well, which is great. Yeah, and compared to my experience in academia, it's a lot better. I had to work on weekends, keep the cell lines and everything. So, yeah.
Sunday nights in the lab. Yeah, for sure, setting up the cells to grow. Yeah, I think that's clearly, there's a lot of, it depends on the employer, it depends on the setting, but it is generally, to your earlier point, where it's more teamwork, and it's less the individual, it's less on the individual's personal responsibility to make everything work or, you know, fail. It does feel a bit more usually like it's a team. There's more, you get a little less personal recognition sometimes, but you have a lot more support, and you get to be a human, which is kind of nice. Not to say that doesn't happen in academia, to be clear, but that is so much more up to the individual PI and what culture they want to set in their lab, is my impression.
Yeah, there are some numbers, right, on the rate of depression and anxiety.
Let's not end on depression numbers. So in the last 10 seconds, well, we're going to wrap up. I would love to get like a one-line elevator pitch from each of you of your final thoughts, if you don't mind. Let's start from the end, Raúl.
Well, my advice when you join like a startup or the industry is just take it one day at a time. I always tell new joiners that in a startup. Yeah.
One day at a time. All right. Yeah. Chipo?
Be open-minded. There are many doors out there, and if one closes, there's always another one.
Yeah, patience and curiosity, and embrace error.
Yes, keep your curious mind and don't be intimidated by job posts listing a lot of things.
Absolutely, and I'll add, ask for help, talk to people and ask for help. Thank you so much, all of you, you've been fantastic. That wraps up our panel. We are going to vacate, and I'm going to give the stage back to Evan, who is going to wrap up the summit. Thank you.